Dr. Fukuda, thanks very much for joining us. How worried are you right now that this crisis involving the swine flu will actually develop into a full-blown pandemic around the world?
Wolf, well, we're taking the situation very seriously. I think the assessment is that the situation is evolving quite rapidly, and we are monitoring it very closely. I think that we don't feel that we're quite there yet, but we are looking at the different outbreaks and the different cases being reported, and so it's quite a concern.
Are you more concerned today than you were yesterday?
Well, I think that over the last couple of days we have been, again, paying a lot of attention to this and have been very concerned about it from the beginning, but I think that we were hoping to see that this would just slow down and disappear, but it doesn't show any signs of doing that so far. So, yes, I would say that we are, quite concerned about it.
Yesterday you raised that threat level of a possible pandemic from a 3 to a 4. The most serious level would be a 6. So what would it take for you to go now to the next level, which would be a 5?
Well, one of the things that we're looking for is that we see signs of established transmission from person to person in multiple countries. The signal from going from 3 to 4 told us that the virus had changed its behavior considerably and was showing the ability to transmit from person to person. And now what we're looking for is evidence that this kind of a pattern is occurring in multiple countries.
Why have there been so many deaths in Mexico, but so far no deaths in the United States?
I'd say that we're really quite early in the characterization of this disease. This is a new infection. We haven't heard about it or seen it before, and so we're just really into it in a very short way. This is one of the big issues, however. What is the relationship of this virus to mild cases and to serious cases? And so hopefully in the days and weeks to come we'll understand how often this leads to a serious infection versus a more mild infection. Right now we don't know.
Does the World Health Organization believe that people should be putting up barriers to travel right now to prevent people, for example, from visiting Mexico or coming out of Mexico or the United States for that matter?
The WHO is not recommending any restrictions to travel, and we are not recommending any border closures. We believe at this point, based on much of the work which has been done over the past few years to study pandemics and what can be done to control them, that travel restrictions at this point would not significantly hamper the movement of this virus. On the other hand, we are quite concerned about the safety of people who might be infected, and so we are stressing that people who are feeling sick should seriously consider deferring travel, while travelers who become ill on their journeys upon returning should seek proper medical attention, both to get the care that they need or deserve, and then in addition possibly to see whether they have this new infection.
What to our viewers here in the United States, Dr. Fukuda, what do the next 2 weeks realistically look like?
I think it's hard to predict what's going to happen over the next 2 weeks, but if we see the establishment of person-to-person transmission in multiple countries, then this really is the signal for moving up to an even higher phase. But I want to point out that these phases really should be seen as signals to countries and to organizations about getting themselves ready for a pandemic. And so they're really planning tools. And so over the next few days, over the next few weeks, this could happen, or we could still stay at a phase 4 situation. I think it's very hard to predict right now.
What about the worst case scenario from your perspective and the perspective of the World Health Organization? What is that?
The worst case scenario is that we do move into a pandemic situation and the pandemic is severe. When we go back to the 20th century, we see that there were 3 pandemics in that century, and they ranged from being relatively mild to quite severe. The first pandemic, the one which occurred in 19, received the most attention and has been discussed a lot in the last few years because it led to a large number of serious illnesses and deaths, and especially in young and healthy people. And so that, some kind of repeat of that scenario would be the worst of all possibilities.
Is the world ready for this?
The world has been paying attention to avian influenza for the past 4 or 5 years, and countries have been working really very hard to strengthen their defenses and their preparedness. So I would say that we can never be fully ready for this kind of situation. We're always taken by surprise when large, urgent outbreaks or epidemics begin. On the other hand, I would say we are so much better prepared than we would have been if this occurred 10 years ago. So I would say overall we are much better prepared than before. But if we do move into a pandemic, it is going to be hard times for a while.
Dr. KJ Fukuda, thanks very much. Good luck.
Thank you.